And I think right now, let's welcome our guest in person of Sonny Olukunle Phillips. He is a public health specialist. It's so glad you just came at the nick of time. Thank you very much for joining us this morning.
Good morning, pleasure.
Good morning. Thank you for joining.
All right, so let's get into it. The first question, which is the most important, how does HMPV compare to other viral respiratory infections in terms of transmission, severity, and impact on public health? I mean, if we would take a cue from COVID-19 2020.
So thank you very much for having me. I think what we all need to know is that the HMPV virus has been circulating across the globe for several years. So it's a virus that has been in most communities and countries, so it's not a new virus. Most populations have developed some measure of immunity to the virus. The other thing to note is also that the incidence wanes and peaks over the seasons. So typically you have it's a flu-like virus, and typically you have flu-like viruses and their symptoms and signs peaking during the coldest period of the year.
Okay.
So same for this particular flu-like virus called HMPV. It's been there, and most times the symptoms are mild and self-limiting, and most patients will get out of it.
Right.
So if you talk of severity, we may not think of it as maybe the highly fatal cases that we were experiencing or we got used to during COVID. It's not within that league.
Right. So we've not really gotten so much information in regards to availability of specific antivirals or vaccines that can help to contain this. But I would like to ask, given the limited availability of specific antivirals or vaccines, what are the most effective public health interventions that we need right now to help properly contain and prevent the spread of HMPV, particularly in Nigeria?
Okay, so globally, there are no vaccines for this particular virus. There are no specific treatment modalities for this virus. What works is supportive care, which is essentially early diagnosis and making sure that the vital signs of the patients are preserved. So you're watching the airway that the patient can breathe in and can breathe without any obstruction. You are watching out to control fever if there is any fever. You're watching out to control the circulatory system. So essentially, this is supportive care that is rolled out for this entity. No virus, no vaccine, no specific medication for treatment as out of yet. But when you talk of public health intervention, some of the points has been railed out in your introduction, which is to, like the government is currently doing, particularly we have not yet recorded specific cases, to ensure that the various port of entries, the surveillance mechanism are tied, so that potential carrier of the virus that may also be having symptoms are isolated very early, and they are quarantined as appropriate. So that is the intervention now. And where such quarantined patients are kept, to ensure that the care providers are also provided with necessary personal protection items, so that they also don't become carrier of the virus from those locations into the greater populace.
All right, thank you very much. I have two questions, but let me start off with the first one. Sometimes when you think about all these viruses and all that, you tend to wonder, how do they even come into existence? Are they man-made? Then secondly, so far it has not been detected in Nigeria, and sometimes we like we like it, or we are used to when the problem comes, then we start to look for a solution. So my second question is, what challenges does Nigerian healthcare system face in detecting and diagnosing HMPV, and how can these challenges be addressed?
Okay, thank you. With the first question of why the viruses. So the question is, viruses exist in nature. We live with organisms. Even our survival as individuals, as humans, is dependent on the various organisms we are carrying in our body. There is a concept of microbiome, wherein we have like a good relationship with these various organisms that has evolved over centuries and millennia as part of our evolution. So some of these viruses, their natural hosts are non-human. Some of them are bats, some of them are in poultry, like the avian flu. But the more we go, so if you talk of bats are in the forest, they are in the bushes. But day in, day out, as part of the development, we are expanding into some of these areas and then increasing contact with organisms that are natural carriers of these dangerous viruses, as it were. So this is why we will continue to record increasing pandemics, epidemics. It's not if, it is a matter of when, because we keep on expanding into their natural spaces, and then we interact, and then there's a crossover from their natural host into human. So that's, it's guaranteed, because it's a product of, it's part of the offshoot of our development enterprises. The second question has to do with the health system.
Yes, how well equipped Nigeria is for this.
Yeah, I get you.
Virus.
So, like in the days of COVID, what played out was that the health system was overwhelmed. Even the best of health system. So, if you have one patient coming in on a weekly basis into a major health facility, that one patient will be quickly taken care of. What happens when you have 1,000 patients with that particular ailment showing up at the healthcare facility in a day? Because you are now having a spike in the incidence of the disease. That is where preparation, you prepare, you do your best to prepare, but at the same time you are praying that your preparation will not be overwhelmed. So the basic preparation, particularly for a disease that you rarely get to experience, you don't cut out so much of your resources focusing on a disease that you rarely experience when you are yet to even get a good grasp of the diseases that you face day in, day out. So there will be occasions where some of these incidents will happen, and they happen at a very minimal level that the health system can quickly take charge of it. What about if they happen at a massive level that they overwhelm the health system? That is where the trouble comes in.
Right. Now, let's talk about genomic surveillance for a bit. We know that genomic surveillance is the process of constantly monitoring pathogens and analyzing their genetic similarities and differences. Now, what is the role, or to what extent can we make use of genomic surveillance in tracking the evolution of HMPV, and how can this information be used to inform preventive measures?
Okay, thank you very much. When you talk of genomic surveillance, you're going a bit higher than the basic level. The basic thing we need to do is to maintain surveillance before we even talk of genomics. Genomics will happen as part of the process, but the main thing is to even ensure. So what is surveillance? That is, you detect early, and that, to me, I think the government is doing its best. There has been on ground working with several health facilities, working across different ports of entries, what is called influencer-like surveillance system in Nigeria to isolate early anyone manifesting diseases that may akin or describe some of these viral episodes that we are having. So where genomics then, it's partly academic, but may also be part of the control, because you may say the kind of HMPV that is the virus that is unleashing havoc in China might be a bit different from the virus taking root in Nigeria. That's where you now want to describe with genomics. But the basic thing is, you want to isolate the clients, the patient early. You want to triage them appropriately into care, and you want to make sure that the care system is isolated, not to be a bridging mechanism into the greater population.
All right, thank you very much. Now, the question I would like to ask now is, Nigeria has been said to be at moderate risk of HMPV. So, is it too early if we start to set up healthcare centers, or centers, that containment centers rather, for this thing, so that once it's detected, the patient is taken directly to the containment centers? And can we have, institutions, hospitals, not just hospitals, but different centers, public centers, have this gadget that we had back then during COVID-19, where it's it's being used to check your body temperatures? Can we just start being proactive before we start seeing cases of this HMPV?
Okay, thank you. Let's give it to the government. I think the good side of COVID was that it transformed the resources that flowed in during COVID, transformed the health system. So you now have all those centers already known. You now have personnel that are now experts, because they manage COVID. They are known. They are in a database. So we can immediately, or at the best of time, quickly roll out intervention, because the system has been tested and tried. So all these facilities are already on ground. The EOCs, epidemic control centers, they are all there across the country. This is not the only virus we are also tracking for crying out loud. Lassa fever is already in the system. It's major with Nigeria, and that same system is already responding. So it's not about, let's now unleash a different sum of resource to cater for the HMPV. No. The resources are on ground. The resources are there. Right. It is just to quickly then respond to this new assault if it ever happened.
Right. All right. Just before we wrap it up with you, right? Let's talk about collaborations, right, with international organizations, even with our local health workers. We know that sometimes those at the remote areas do not really have this knowledge. So two questions in one. How can we better engage communities and local health workers in spreading awareness and promoting behavioral changes to reduce the spread of HMPV? That's one. Two, how can Nigeria collaborate with international health organizations to strengthen its response to emerging infectious diseases, just like this HMPV?
Okay, thank you. So let's start with the second question. Even from the intro, part of the assessment that went into coming to the conclusion that Nigeria is as a medium risk was done with input from major global players, your CDC, your WHO, working with Nigeria and CDC. So this is also some of the lessons from COVID, that you can't afford to leave a country to deal with some of these major health issues. So that system is already on ground. So rarely do you have a government now or a nation that is flying this kite of rolling out appropriate control mechanism alone. No. that international mechanism collaboration is on ground through your WHO, through major donor agencies, to ensure that, because the safety of one is the safety of all. It's now a global, the entire world is now a global village. So you don't leave one country to grapple with this challenge and then think you will be safe. No way. So secondly is the issue of how do we mobilize the community, the populace at large. I think we already have a system on ground. It's just to layer this additional information on it. So the same system with which we inform the entire community about COVID is still there. A whole lot of was done through community leaders. That system is still there because I'm aware of that, particularly through the national primary healthcare agencies. There is an advocacy aspect of the work that works with various community leaders. That system is still there. It will, if necessary, require passing the information both digitally through the mass media, using local languages, working with celebrity. I know that system will be mobilized if and when necessary.
All right, fantastic place to land this morning. Thank you so much, Dr. Olukunle Phillips. It's been a delight speaking with you on this very important topic, and we hope to have you join us some other time again. Thank you so much.
Pleasure.
Enjoy the rest of your day. All right.